Yes, so the topic for today is COVID-19 and the Dormant Butt Syndrome. It sounds a little odd. The word "butt" may be a little, what is she talking about? Is she a physiotherapist? Is she a scientist or not? But anyway, this word is such a common word. And it's a very big syndrome actually, and that's what I'm going to talk to you about, and especially in COVID times. So in the 21st century, the dormant butt syndrome has affected more people globally than any other health problem in the world. But its prevalence ever since the COVID-19 started is affecting even more people than before. The rich, the poor, the sedentary, the sports persons, all are affected, and even children have not been spared. I'm not talking about those who have suffered from COVID-19. I'm talking about those who have never suffered from COVID-19. And the reason for this is because we're all housebound. When I started physiotherapy practice almost 40 years ago, the average age of my patients was 60 years. It was 45 years before the pandemic started. So it already had started falling because of younger and younger people getting the problem. Now it is 30 years. Imagine in this more than 1 year, it has fallen so much. So a lot of young people are affected by not only the pandemic, but what I'm talking to you today is the dormant butt syndrome. And of course, physiotherapists are busier than ever. We have nothing to complain, but I don't want people to get affected, of course. And there are going to be long-term repercussions, probably what we don't realize now, unless we wake up soon. What are the consequences of a dormant butt syndrome? If you have a dormant butt syndrome, you're more likely to have hypertension, type 2 diabetes, cardiac problem, obesity, and a host of musculoskeletal problems. Unfortunately, none of these can be detected by MRI, X-rays, or blood tests. Yeah, these are the host of musculoskeletal problems that we can get. Pain behind the thigh, hamstring strain, pain on the side of the hip, that's your TFL IT band syndrome, pain in the knee, especially the patellofemoral syndrome, cervical problem, lower back problem, pain in the sacroiliac joint, and pain in the piriformis and the sciatic nerve as a result, pain in the heel, and plantar fasciitis. So we have a lot of problems that could be the original cause, could be the dormant butt. And of course, it can contribute to poor posture. So you have what we call the anterior pelvic tilt, the body shape changes, the abdomen protrudes out, and the spine becomes more curved. And as a result, then the thoracic spine becomes more curved, the neck gets more curved. So you see, there are problems that affect right from the head to the toe because of the dormant butt. So what is this dormant butt syndrome? It results from weak or dormant gluteal muscles or the butt muscles and very tight. So these are the gluteal muscles and very tight muscles in the front of the thigh, and that is the hip flexors. This happens because of a process called reciprocal inhibition. What is reciprocal inhibition? It occurs when tightened one muscle group, for example, in this case, the hip flexors in front of the thigh, creates a length problem on the opposite side, and that is the gluteal muscles. So these muscles in front of the thigh become tight, and these muscles at the back of the hip, both the gluteus maximus and the medius continuously get stretched, and any elastic you stretch for days and days and months, it gets weaker and weaker, and this muscle gets tighter and tighter. But the very good news is that we can get rid of this problem and not suffer the consequences of the dormant butt. It's not a new phenomenon. This dormant butt syndrome is not new only in COVID times. So as the man evolved from the four-legged animal to the erect posture, And you see how well our gluteal muscles started developing, and we had a lovely, strong glutes for the erect man. And then we all started working in the forward direction, whether it was in the field, or whether it was hunting, whether it was digging, and of course now the computer. And the gluteal muscles started forgetting to keep the body erect. Yes, dentists also can fall into this trap, because now from the standing dentistry, we have the sitting dentistry, and all busy practitioners are sitting for hours and hours from morning till night. But in this pandemic, everyone has been parking themselves on a chair, sofa, or bed for hours. Whether it could be for entertainment, whether it could be for work, we are all the time sitting. Even children are doing online studies. They are having too much screen time, so they're sitting in all kinds of postures, and unfortunately, they are also becoming a victim to the Dormant Butt Syndrome. And then when our hip flexors are tight and our butt muscles are attenuated or stretched or weak, we tend to sleep in these postures. So we sit in the wrong posture, we sleep in the wrong posture. That's more than 2/3 of the day gone. Why are you more likely to get hypertension, diabetes, and cardiac problems and obesity by sitting? So there was a largest and longest study ever conducted on middle-aged women. And it was found that for every 2 hours of continuous sitting, 23% higher risk of becoming obese, 14% higher risk of developing diabetes, and high risk for both hypertension and heart disease increases. What happens is that we have an enzyme called lipoprotein lipase in our blood vessels. It normally grabs fat out of the bloodstream and moves it to the muscle when we move. But just after a few hours of sitting and not moving, this enzyme basically turns off. So when this LPL is suppressed by sitting, harmful fats build up in the bloodstream and good HDL cholesterol levels start dropping. In other words, when you are sitting, there's a virtual fat burning. There is no virtual fat burning in our body. So what should I do to not get a dormant butt? Think of movement as an opportunity, not as an inconvenience. Humans are designed for movement. Right from the man when first came on the earth to our villages, even now the movement is much more, and they don't get these problems that we city dwellers tend to get. Don't get sentenced to your desk, to your computer, to your chair. Stand often and take breaks often. Every 30 minutes, you should take a break of standing, walking for at least 10 minutes. We should reduce our TV time, if at all. Earlier on TV, there used to be ads. So I used to tell my patient, every time there's an ad, you walk around and come back and sit only when the ad stops. But now with the Netflix, I can't even say that. And people are hooked to the TV for hours with this Netflix, sitting in all kinds of postures. And I said, and as I said earlier, our physiotherapy practice is proliferating, but not a good thing happening. So when you socialize, you want to chat with friends, why not go for a walk so that you include movement in your day-to-day life? Office meetings can be done in the walking position. So why not walk and have meetings instead of sitting across a table? Standing desks, of course, are very popular, but even better would be the slow treadmill, which moves very slowly so that your leg muscles are moving and you are still doing your computer work. Yes, standing desks are very easily available now, and we should all have those. In fact, I have put my laptop on a standing desk. Of course, right now I'm sitting and talking, but yes, I can lift it up and I can stand and work for hours. In this COVID time, especially true, climb stairs. Do not take the elevator. But it is true, it is very true for the dormant butt to use your leg muscles and to use your butt muscles instead of the elevator. I had done a study right from Churchgate to Dombivli on women. And what I found was that women who regularly traveled in trains were much fitter and did not have as much as of the dormant butt as much as those people who always travel by car. So after COVID is over, if you want to go to office, travel by train is the motto. Pedometers, we all must have. I always wear one. The reason is that if you don't wear a pedometer, we don't even know how few the steps we take through the day and how much cardiac work we do through the day in our natural day-to-day activities. So, which exercise could help me make my dormant butt stronger? There are two types of exercises. Those that make my glutei or the hip muscles at the back stronger, these muscles here, and the ones to make my front muscles or the hip flexors less tight or more flexible. We possess three gluteal muscles, the gluteus maximus, which is the largest of the lot, and the main muscle which gives us the erect posture. And then we have the gluteus medius, another very important muscle on the side. And then we have the minimus, which is comparatively a smaller muscle. So these three gluteal muscles actually make the glutei. In most people, gluteus medius, especially I want to tell you about, it's the forgotten muscle. It is weaker than gluteus maximus. Even if very fit individuals come to me, I do treat sports people, so I know that even they do not have a very strong gluteus medius as compared to the gluteus maximus. What is the importance of gluteus medius? They help us keep our balance when we stand on one leg, when we walk, when we run, we go up and down the stairs, they keep our balance. They prevent falls, which are common in the elderly, especially because their muscles get weaker and weaker. And if this muscle is weak, it causes pain in the joints of the lower extremity, right from the hips to the feet. If the gluteus medius muscle is weak and you do not give any specific instruction for somebody to do a squat, they are very likely to do it like this, with the knees pointing inwards. If anybody does squats like this spontaneously, that means the gluteus medius muscle is weak. And this is actually, as we all know, correct way of doing the squat. Many children have the habit of sitting like this. It should be discouraged because they stretch their gluteus medius a bit too much right from a childhood, and therefore, but better than sitting like this is the sitting position of sitting cross-legged. Now you see this young girl who is playing soccer. You see how her thigh is moving inwards and her lower part of her leg is moving outwards. She probably, very likely, has a gluteus medius weakness, and that would actually make her knee very vulnerable to problems in future. And same with this girl who is skating. You see the angulation of her thigh. Not a good idea. She may end up with problems of the lower extremity. So let's find out which are the best exercise for both the glutei. A team of researchers at the University of Wisconsin, led by John Porcari and Blake Ristvedt, used EMG or electromyographic analysis to compare the muscles recruitment patterns of 8 common gluteal exercises. And what they found was that in case of gluteus maximus, if you compare it with the traditional squat, most exercises like the single leg squat, the step ups, the lunges, and the four-way hip extensions were almost as good, the quadruped hip extension being the best, but the vertical and horizontal leg press that we often do in the gym was not a great exercise for the gluteus maximus. And when we found the activation of gluteus medius, it was found that again, the quadruped hip extension was one of the best exercise to activate the gluteus medius. And again, vertical and horizontal leg press were not that great. And the step-ups and lunges were better than some of the traditional squats that people did. So before I suggest any exercise for the dormant butt syndrome, a few clarifications I would like to make. Exercise prescribed to you should be done after taking care of your medical health. The exercise that I would suggest today is not to be done for each and every. We are all different. Our bodies are different. Our musculoskeletal is different. We have different health problems. So ideally, these are only suggestions that I'm going to make today. But you must get a thorough neuromusculoskeletal evaluation done by a physiotherapist, and also show a physician for your health-related problems. Most people do not know, but I want to also emphasize that exercise prescription should be as perfect as a drug prescription to have benefit and not cause harm. Wrong exercise can do more harm than good, and hence, before you do any of the exercise suggested by me today, consult your physician and your physiotherapist. Okay, let's have a look at a simple exercise, which is the bridging. So in every exercise, I would definitely tell her to tighten her gluteal muscles as she lifts her hip up. She should be digging her heels into the floor, and she should be tightening her glutei as she lifts her hips up and down. The mind-body connection is very important. You should be thinking of your glutei when you do a gluteal exercise. For every exercise, this holds good. And then we can challenge it by using a unstable surface like the one we've used here. Again, the glutei are supposed to be contracted as she lifts her hips up, and she's supposed to focus on her glutei as she lifts her hips up. Now, this exercise is a little more challenging, the earlier exercise of bridging, where she not only has to tighten her glutes, she has to lift her hips, but also she has to straighten one leg, which makes it much more difficult to keep her glute activated and her core activated. Clamp is a wonderful exercise for the gluteus medius, especially. When she does this exercise, she should not be moving her pelvis at all. Her pelvic area should be very steady, and she should be doing it slowly, and muscles on the side of the butt, the gluteus medius, is activated in this exercise. This is a little better position for doing the same gluteus medius exercise. And he is doing it much better, more slowly, though his range is less, but the activation is much better. So hold your pelvis and then do it with little straighter legs and feel for the muscle. Every time you do every single exercise, you must feel whether you're activating the right muscle. This is another wonderful exercise for the gluteus medius, especially where the hip is extended. That means it's taken at the back. It's externally rotated so that the feet are pointing to the ceiling, and then you start lifting it up. And when you do this, and then you're doing abduction. So you are taking the hip behind, you are externally rotating by pointing the toes up, and then you are lifting the leg. your focus is more, or you are isolating the gluteus medius muscles and therefore activating it very well. This is another way. There are lots of ways you can activate the gluteus medius. This is a thigh. There's a band on the thighs, which is supposed to be a little stretched, so that not only your gluteus maximus, while she's extending her hips, gets activated, but also gluteus medius gets activated. So it is useful for both the muscles. And of course, people like Dr. Bajaj can do this exercise, because the exercises I've shown earlier would be like child's play for him. So yes, those who are fit in the audience can use weights for the same kind of exercise. This exercise is one of the very good exercise for gluteus maximus. And when you tie a band, even the gluteus medius fibers get activated. It's important to keep the knee bent at a right angle. This is very important. Otherwise, the hamstring muscles get activated more. As it is, most of us, I would say 99% of us, have stronger hamstrings than the gluteus. And therefore, we do not want the hamstrings to get more and more strong. We want the gluteus. Therefore, keeping the knee bent is very important. If you notice, so by taking his knee more forward, he's doing a full range hip movement of the gluteus maximus. And here we are challenging them for activating many other muscles too, which work in conjunction with the gluteus maximus. But by lifting the arm up, she is also on an unstable surface. She's not an unstable surface, but she's unstable. So the gluteus medius automatically starts firing much more. And the sideways lift, a lot of people call it donkey kick. So it fires the gluteus medius very well. And if you cannot remain on your wrists like this for a long time, this is a good alternative to go on your elbows and do the same exercise. All exercise have to be done slowly. And EMG studies, when you do the electromyographic studies, it shows that a wider stance during squats activates the glutes more, and the deeper you go, it activates the glutes more. Of course, all those who have knee problems, patellofemoral problems, are not advised to take the hip below the knee. If you do not have any problem with the knee at all, then you can take the hips below the knee. It's important she presses a heel into the floor as she comes up. That will fire the glutes much more. And then you can do squats on unstable surfaces. It's more challenging to do it. Now this is on your right she is standing on an unstable surface, the Bosu, and doing the squat. Whereas in the other one, she's doing a lunge on an unstable surface. And we all know about deadlift. Of course, here she's taken a very light weight, and but the angle of bending down is very important, and using your glutes for coming up. So pressing the heel into the floor as she comes up is so important to get the drive or the activation of the gluteus maximus. And of course, yes, you can do it with weights in your hand. Ideally, it should be done much more slowly. Single leg squat can be quite challenging for a lot of people. It is excellent for not only the gluteus maximus and the thigh muscles, but it's also very good because you're balancing on one leg. So it's very good for the gluteus medius. You see, she's a little unsteady, though she's a young girl. They're all my patients who have recovered from problems earlier and have very gracefully allowed me to record them. In the squat position, rotations help to activate the glutes also. This is a great exercise for gluteus medius, which I told you it's a muscle that helps us keep our balance. Now, as I said, that he needed support, so I gave him the chair to take a circle, and the circle should be with a straight knee and a slow circle with your toes pointing outward, and you should be standing perfectly straight. If your gluteus medius is not weak, then you will be able to stand straight and do this exercise. And but if you need a support, then take a support initially and do it. And then we can challenge it further by standing on unstable surfaces and then doing the same exercise. Step up is another great exercise for the gluteus maximus especially. Again, she's lifting herself by pressing the heel on the bench. She presses the heel, comes up, and then comes down. Now, I have given him a higher level. So as he lifts his body up, he puts his foot, presses the heel, comes up. The moment you press your heel into the floor, you will find the activation of the gluteus maximus happening. But if you climb up the stairs, for example, without pressing the stair, you will not get the firing of the gluteus maximus. You can climb up 10 floors without firing hardly firing the gluteus maximus. This is a great exercise for gluteus medius, where you're walking laterally. There are many ways you can do it. This is one of them. Okay, now we come to the stretches. So I did say that we need to strengthen the gluteus maximus and medius, but we also need to stretch the hip flexors in the front of the thigh. Now, the key to this is that whenever you stretch the hip flexors, you must also tighten your hip extensors, that's your gluteus. Otherwise, what happens is that your hip flexors do get stretched, but there's no permanent effect. So while doing the stretches, you must tighten your gluteus maximus. And that's what she's doing. As she goes further, her front of the thigh muscles are getting stretched, but at the same time, she's activating her gluteus maximus so that the effects are more permanent and long lasting. This is a lunge. Again, stretching the front of the thigh. And in this case, the knee is bent. So even the rectus femoris, which is another flexor, also gets stretched when he bends his knee. And he's at the same time, he's activating his gluteus maximus. Always the stretch is much more on the hip flexors if your gluteus maximus is activated. And this is a hip flexor stretch with the arm raised. Your hip flexors are connected to the abdomen, to the spine. Most of you know about the psoas muscle. It comes from the spine and is attached just below the hip. So when you raise your arm, you get an even more stretch in the hip flexors. I've given him something soft under the knee. You can also take that if your knee hurts when you do this exercise. You're supposed to keep your body erect, not supposed to lean back. And now I've bent his knee even more. So now he will not only get a stretch of his iliacus and psoas, but also of his rectus femoris. And this does make it more tough. But all the time his glutei are firing so that the stretch is more on the anterior part of the thigh. The most common mistake that we do is we stretch our muscles without tightening our antagonists. And these are more challenging ways you can do the hip flexor stretch. Often I get people who say that I'm a regular exerciser. Why do I have a Dormant Butt Syndrome? These are people who either they take part in marathons regularly or they go to the gym. And they are, when I do a musculoskeletal evaluation, they say that, how come you are saying I have a dormant butt? I exercise my butt every day. So how can you say that? So to talk about that, why it happens, let me tell you the story of this 26-year-old Abhishek. He wanted to take part in the Ironman triathlon competition. If you know that this is one of the most difficult one-day sporting events in the world. And he had been training since last 3 years, doing all the exercises prescribed by his trainer, doing a wonderful, sincere job, and taking also guidance from a nutritionist. So he had no complaint of pain when he came to me, but his speed and stamina were not improving as he was expecting it to improve, or his trainer was expecting it to improve. So for Abhishek, I did a thorough musculoskeletal evaluation, and I found that most of his muscles were in top condition, but he also suffered from the Dormant Butt Syndrome. And this is not a common story with the most fit people, individuals that I have seen. But before I tell you what I did to improve his speed and stamina, let me tell you what is sports physiotherapy for sports enhancement. So what we do is, these people who come to us without any pain, what we do for them is that we help them improve their performance in whichever sport they are already into. For example, if somebody wants to take part in a marathon, or already a marathon runner, like him, he was a triathlon runner, and or he wants to start a new physical activity like running or tennis, or if they want suggestions that I want to be very fit, what kind of exercise should I do? This is called preventive physiotherapy, not very well known. Most people come to us with aches and pains. I always tell them, please come to us for preventive physiotherapy. Come to us, we will do your musculoskeletal evaluation and then suggest specific exercises for you, which would help you not only improve your performance in that particular sport, but also in preventing injuries. So when I was at the University of Southern California, we did this preventive physiotherapy for children right from the age of 5 years to 18 years. And what we did was, we did the musculoskeletal evaluation, and then we suggested specific exercise for each child. When they started doing those exercises, By magic, they became better in whichever sport they were, whether it was soccer, whether it was tennis. They started improving. They very rarely they got injuries, and so this is something that it is very close to my heart. But preventive physiotherapy is not very well known in the Indian scenario. So how do we go about it? So in all of these cases, before we prescribe physiotherapy treatment for any patient, we do a thorough neuromusculoskeletal evaluation of the patient. Find out the source of the problem, make a diagnosis, then prescribe tailored or individualized and specific physiotherapy treatment. Our diagnosis is very different from an orthopedic diagnosis. For example, osteoarthritis of knee is an orthopedic diagnosis. What we go is much more specific. So, is it a rotation syndrome of the knee? Is it a patellar glide that is causing the knee pain and things like that? So we are our diagnosis is a little different from and we find out which are the muscles that are overactive, which are the muscles that are underactive, causing the joint problems. And the greatest benefit of this is not only do they start excelling in the sport with these specific exercises, but they are less likely to get injuries. So what did I do to improve Abhishek's speed and stamina? I emphasized a few things that he was not doing to that extent very well. That he should exercise both his gluteus maximus and gluteus medius. His gluteus medius was weaker than the gluteus medius was weaker than the gluteus maximus. I also added the mind-body connection, meaning that when he did all the exercise that he did, which he was doing very sincerely, he was not focusing on his muscles, which muscle is supposed to be working. When you're doing an exercise, you must focus on which muscle is expected to move. So when he was doing exercises for his gluteus maximus and medius, or in fact stretching his tight hip flexors, he was not focusing. He was just doing it without the focus. So the mind-body connection is extremely important. So when, for example, this girl, when she's taking her thigh up, I would emphasize on tightening her glutes, not hyperextending her spine. Her core should be activated. So little things make a big difference. The girl who is doing the squat, I would tell her when she is coming up from the squat position to press the heel into the floor as she comes up so that her glutea are activated. Some of the exercises where you have to use both the gluteus maximus and the gluteus medius, like this one leg squat was also, I introduced it for better balance, because when you run, you need much more balance, which we are not aware of actually. I also asked him to focus on pressing the heel into the floor, or in this case, the bench, when he would go up, step up. When he did the stretch of the hip flexors, I asked him to tighten his glutes and at the same time stretch his hip flexors. That made a big difference to the long-term improvement. And after all this hard work and our guidance and that of his excellent coach, Abhishek performed very well in the Ironman competition, made us all very proud. So, do you get dormant butt syndrome because of wrong exercise? Yes, you do. Certain exercise like this one, a very favorite one of lower abs, is a wrong exercise. We get so many people straight from the gym to us with a slip disc. But that's one part of the problem. But definitely you're tightening your hip flexors. The muscles in front of the thigh are getting tighter and tighter, because anybody who lifts his legs up like this will use his hip flexors, make them stronger and stronger and stronger. And that's then it becomes difficult and end up with the dormant butt syndrome. We often do extensions of the hip. That means lift the left backward. we often get cramps in our hamstring area or the back of the thigh area. And when we get cramps in our back of the thigh or the hamstring area, that means you've used your hamstrings more than your glutes. And that is why your hamstrings are going into a cramp, because you're overusing. And the reason for overusing is because your glutes are weak. So you are sort of using your hamstrings to do that action, whichever you're doing. So this kind of an exercise where you're not bent your knee. If you remember the earlier exercise, I had told the girl to bend her knee at right angles. If you don't, is to put the hamstring at a disadvantage. Now, in this case, the leg is straight. So very likely she will be working more on her hamstrings, the back of the thigh muscles, these muscles here, rather than the glutes. There will be some activation of the glutes, but the activation of the hamstrings will be much more. So what's my take-home message for today? The Dormant Butt Syndrome is the most common musculoskeletal problem of the 21st century. It is associated with a host of lifestyle-related diseases and many orthopedic problems. Sitting less and doing specific exercises more are benign, quick, and long-term solutions to the problem. So just do it. We have to just do it. There's no shortcut to it. Thank you so much for your patient hearing. Thank you.
Thank you so much, ma'am. A fantastic lecture and a very different thing, very different approach. And we do not realize that these things happen to us. Here, I'll give you a simple incidents. Ma'am may not even remember about it. So, a story goes back to 2012. And I always used to, being an endodontist, doing multiple number of root canals, and during those days, initial days of my career, I used to travel, visit many clinics and different chairs, different working positions. Some of the chairs we know that they are very comfortable to work, but some of them are not. And I always used to have my spinal issues, and especially cervical ones. And that typically used to happen at least once in a year for sure. And that those acute pain and lying down on the, you are down with the pain and you are losing those few days or say 1 week of bed rest and all. I used to go through that story always. And there are so many times my wife has taken me to the doctor because I'm in extreme pain. So in 2012, I had this severe neck pain. I was put on drugs. I was even given steroids, and I somehow could sail through. There were a lot of patients in my hands. Some of the NRIs and all time-bound patients, and the things worsened so much that in spite of having steroids, I just could not move. And then I was suggested to visit Dr. Snigdha Mehta that time. I met I met some of the orthopedic surgeons, and they straight away suggested me to get admitted and get operated for cervical spine. And I was clearly told that there is herniation of the disc, and to relieve the pressure, you have to get operated. And when I met ma'am, she told me, "Don't worry, Ajay, first stop all the medicines." I couldn't believe. I was like, "Stop steroids, stop all the painkillers, stop everything, you'll be fine." And I was like, "Ma'am, when everyone is telling me to get operated, you are asking me to stop medicines." They are like two extremes. It was unbelievable. In spite of she telling me stop all the medicine, it took me 4-5 days to stop them because I couldn't believe that time. And she gave me a set of exercises. I recovered very well. Of course, you do have some other issues sometimes. I got into exercises and I decided to make my musculature stronger. I still keep taking guidance from her. I remember during my early gymming days, whenever I used to do deadlift, I used to get pain in my knees. And I used to wonder why this happens. My trainer used to tell me, wear a knee cap or my trainer used to tell me, like typically those gym tips, and I used to apply ice packs to your knees when you reach home. I was doing everything that is possible for my knees, but then it didn't really help me. Then I went to ma'am and she told me, Ajay, it is not your knee problem, it is your dormant butt syndrome. It is, although you are exercising, your the butt muscles are not that strong. Again, it was difficult for me to believe. Ki, okay, iska kya connection hai? How does this happen? But this is what is important, to have a correct diagnosis and to guide you through correct channel. And all she mainly, meaning she typically the way she showed in one of the exercises in deadlift, that all other exercises that if your knees are coming closer, that means your gluteal muscles are not very strong, right, ma'am? If I'm not wrong, right? So she actually
especially the medius, yeah,
exactly. So, and she gave me some exercises to do at home, to do in the gym. She gave me one of the weight exercise which she showed, where she told me that tell your trainer to get this exercise done from you. And believe me, I did not really do anything for my knees. I did the exercises which she gave me for my gluteal muscles, and I recovered completely out of it till date. So we have to know the correct thing, the correct way to work. So a lot of problems, we feel that it is only our spinal problems or other problems, but they are basically related to this common group of muscles. And ma'am, you have always been saying that this is absolutely an ignored area, ignored part of the body. We all feel that it is just a piece of flesh, and their muscles, and they need to be taken care. We don't even want to look at them. I mean, we don't even have to, don't want to even talk about them. And you really showed a lot of exercises, very, very simple exercises. Trust me, they all were very simple. And I'm sure this lecture is going to have a lot of revisits from our viewers, because it is difficult to remember all the exercises in one go, but they can always see this lecture again and again and pick up those few exercises and start doing them as well. So, ma'am, there have been some questions. Can I take them?
Yeah. Yes, sure. I'm not sure. My internet is a little unstable. Can you hear me properly?
Yes, I can hear you properly. Probably sometimes your frame is freezing, but that's okay. Fortunately, presentation.
If you can't, then tell me. I will change it with the dongle. The internet.
No, it's okay, ma'am. It's okay. Your presentation was clean and clear.
It's okay? Okay.
Everything was okay, including the videos. Everything went fine. So the questions.
Okay.
Somebody asks, what about skipping, ma'am? Does skipping help us in making our butt stronger, our musculature stronger? So I probably I would tweak this question and ask you, ma'am, is skipping is a good exercise? And if it is a good exercise, for what all body parts it works on?
Sorry.
You couldn't hear me. You want to change your internet, ma'am?
No. Yeah, maybe yes. Let me just try. Yeah.
Okay.
Okay, now is it better?
Yes. So there is a question.
Yeah, about skipping, but I couldn't get the question.
Is skipping a good exercise?
Okay. So, well, good word is a very difficult word, because what do you mean by good? What is the purpose of doing skipping? Is it the aerobic cardiovascular capacity you want to increase? What do you want to do? Now, skipping, I would not advise for people who do not have good stabilizer muscles. What I mean by that, there are three types of muscles as far as function is concerned. There are the local stabilizers, the global stabilizers, and the global mobilizers. Let me give you examples to make it a little more clear. So the local stabilizer would be a transversus abdominis, pelvic floor muscle. Those are the local stabilizers. Then global stabilizers would be your gluteus maximus and medius. And your global mobilizer would be a hamstring muscle or your quadriceps muscle. Of course, the vastus medialis is again a global, so we don't have to go into the details of it. But what I'm trying to tell you is, so the stabilizer muscles stabilize every joint. And the global stabilizers not only stabilize a joint, for example, the gluteus maximus stabilizes the sacroiliac joint, the hip joint, but it also moves it. So if your stabilizer muscles are not in good shape, I do not recommend skipping for that person. But if your stabilizer muscle, because skipping is an action that we do with our mobilizer muscles, okay? So if your stabilizers are not holding the joints properly when you are skipping, there's an excessive movement in the joints that's happening, and it won't happen in one day. Over a period of time, if you're regularly skipping, you will probably get more osteoarthritic changes over the years. If you skip without the global mobilizers, the global stabilizers, and the local stabilizers being in good condition. And this is applicable to a lot of such exercises. So yes, skipping is good. If the stabilizers are excellent, then you can go ahead and do it. It's a good cardiovascular exercise. But if every time you are hitting the ground, you are getting a little extra movement in your joints, which could be your ankle, it could be your foot, it could be knee, it could be the hip, it could be the spine, it could be a sacroiliac joint, any of these. Plus the posture in which you do the skipping. So there are a whole lot of people who do skipping in very different ways. So your posture is also very important. So yes, it is good if all of this is there. Otherwise, no.
Okay, great. So I did not know that skipping has got so much of science behind it. Or probably we can say that if you're doing in a smaller number, it is good. I know some people who are doing it in thousands and thousands, which is probably not a good idea, very good idea. Yeah. Right? Okay. Right. My work necessitates being seated. So how do I find a benefit? I don't know what he means, but probably he means that my work demands me to be seated all the time. So
that's a story all over the world, and more so with the younger people. Everybody works in the sitting position, whether you are a computer engineer or whether you are a dental surgeon. Everybody's sitting and working, right? Yes, so it is something that, and that is why I don't know whether the question is from a dental surgeon. If it is from a dental surgeon, then I would say in between two patients, you should take a 5-minute break, 5-7 minutes break, and exercise some of your muscles, do some of your stretches that I suggested today, and then come back and treat, then that will be much better. But if you continuously sit, then you get into that body position. If you've seen older people who are in their 70s and 80s, they lean forward, the knees are a little bent, and they get into that posture because for years they've sort of, as we grow older, we get into these flexion postures, right? Bending forward, knees slightly bent, hips slightly bent. So, and that's because of prolonged sitting. Very few people are very erect even in their 80s.
Correct.
So yes, if it's a dental surgeon, a 5-minute break, a 7-minute break, exercise, come back and treat the next patient would be the answer.
In a way, things in COVID times are in our benefit. Previously, what used to happen is like we used to be working. We used to simply one patient gone, second patient in the chair. It was like we hardly used to get time between two patients. Now we have to sterilize our cabin. So between two patients, we do have some time. So there's always a possibility that we can stretch ourselves and we can do some of the exercise. So, ma'am, taking a cue over here, do you suggest 2, 3, 4 simple exercises for us as dentists to do between two patients? It's not only about the butt, it's generally for my spine, for my cervical spine or whatever. Maybe 2 or 3 or 4 exercises which you should be doing, which are quick and simple.
So a simple answer would be, if you are bending forward, rotating your head in a particular direction while you're working, do the opposite.
Okay.
So if your trunk is turning in a certain angle all the time, do the opposite.
Correct.
Right? So that's what, if your hip is remaining
bent. When we are working, we are working on the patient, typically bend like this.
Right. So do the opposite.
It's not only downward.
Turn in the opposite direction. Yeah.
Okay.
So, so that your body doesn't get fixed into that angle. And same thing with the hip. If your hip is remaining bent most of the time in the sitting position, then stretch it out. Take it backward. Take your thigh backward. If your knee is remaining bent most of the time, then stretch it out. Open it out. So do the opposite of what you have to do compulsorily while you're working.
Exactly. So that could be a very, very simple answer, and it is very easy for us to do. So as we get up from the chair and we move to our cabin, we can always stretch ourselves. We can always do those opposite movement to the spine, to our neck, to our knees. Do you suggest exercises for dentists with osteoarthritis?
Osteoarthritis of which joint?
That's the question. Probably.
Okay. Of course. Anyway, yes, of course. It may be any joint. We have been able to avoid surgery, like, knee surgery. Osteoarthritis of the knee is a very, very common problem, right? In fact, one of the most common problems. And we have been able to avoid surgery for the osteoarthritis of the knee, and with specific exercises, reduce the pain, reduce the discomfort, and made the person much more active. So in most people, you do not need surgery. Even the worst x-rays I've seen, and we have said, okay, if you have a little patience, give us 1 month or 2 months, do sincerely these exercises, and then tell me how you are. Only if you still don't get better, then you go for surgery. And most of them have cancelled their appointments with the surgeon.
I know some of the cases, some of the patients, where at least they could postpone their surgeries by a few years, for sure.
Yes. And in case they do need a surgery, then the exercises, because surgery will not make your muscles better. Ultimately, the recovery from surgery is also much better if you have exercised before. And that concept is not there in our country, that we should exercise at least for 2-3 months in case of osteoarthritis before we go in for surgery.
Yeah, that's a very, very important point. I have seen, I remember one of my relatives wanted to get operated for knee surgery, and she was in bad shape, meaning surgery was necessary, and Dr. Snigdha Mehta made her do some exercises to prepare her for the surgery. Otherwise, and her recovery was fantastic. So it's a very vital point. It's not I require surgery, meaning I just go ahead and do the surgery and my knees are going to be fine. No, we need to make the musculature around it stronger. So it is a very, very important point which she has mentioned to us. Ma'am, there's a question. Can you please explain us about treatment of plantar fasciitis? Also, if possible, can you explain?
Yeah, so plantar fasciitis is basically your muscles at the bottom of the foot get inflamed, get tight, get overactive. Now, again, I would go back to up the chain, the muscles. So I would do a musculoskeletal evaluation. I would check that person's posture. Very often they have a tight calf muscle. Very often they have weak glutei. Very often they may have a flat foot. So if after checking all of these, we can make. I'll tell you, one of my patients who came recently. She had a very bad heel pain and plantar fasciitis problem. And ultimately her surgeon who was treating her told her that you have to go to a surgeon in Chennai. That's the only surgeon who does this special surgery. So she was ready for it. She said, let me take a chance. And she came to my clinic. I checked her. I showed her specific exercise. She was a little obese also. She lost some weight also. But her muscles, after giving them those exercises, she didn't need the surgery. Super. So we can, and that is the value of our evaluation, which is very different from an orthopedic surgeon's evaluation. So we can make a lot of patients their plantar fasciitis also much better with specific exercise. But checking it is important to be able to tell what exercise exactly that person needs.
Yes, exactly. Even for someone to know that for a simple thing like plantar fasciitis, one should go and visit physiotherapist is also a big thing. Meaning people probably will not think of going to a physiotherapist for this. They simply will go to doctor. They will simply be on medicine, and as you said, somebody may just simply suggest them a surgery, and they may probably can go to a surgeon. Yeah. So that's really important for us to know and get the things diagnosed correctly. So do tell us what are the exercises of. Okay, this is a COVID-related question. And can you suggest us some exercises for breathing who's suffering from post-COVID short of breath due to lung involved during COVID?
Yeah. So breathing, yes. Breathing is a very important part of our body and which we take for granted until there's a problem. So I'm not sure whether this person has had COVID-related breathing issues. I assume that. Yes. So the first thing that we always say in the acute stage, lie on your stomach because the lobes at the back, the lower lobes are mainly at the back. And when you lie on your flat on your back like this in a hospital bed or when you are having breathlessness, your lungs cannot expand very well. So lie on your stomach instead and then change position to the sides. That's one thing. Second is to do the breathing. Usually we say that breathe in to 3 counts, breathe out to 6 counts. So the breathing out should be longer and the breathing in. And we feel the different parts of the lungs. For example, the lower costal area, we put our hands there and breathe in and breathe out. So we can get a cue from our hands that, okay, this breathing is good or not good. Are the lungs expanding or not? Sometimes they use a lot of these accessory muscles in the neck for breathing. So, and the posture may be affected. They may be a little hunched. So we correct the posture. We also prescribe some exercises for thoracic extension so that when they open up their thoracic spine, their lungs also open up well. And then we teach them diaphragmatic breathing. That is the hands on the abdomen. And as you breathe in, relax your abdomen. And as you breathe out, pull it in. Mm. So these are some of the exercises that they all should be done very slowly and also with the counting in your mind. So that usually we do double the number of seconds breathe out and compared to breathe in.
Okay, great. Fantastic. So another question, do you think doing yoga regularly can help us in, as a dentist, following yoga can help us?
Yeah, of course. Yoga is a wonderful science, but it's also a science.
Yes.
So having trained in yoga for many, many years, and I also teach therapeutic yoga. yoga is not about flexibility. That's a wrong concept that people have. That if you want to be flexible, do yoga. It's about alignment of the body. So the science of alignment of the body is very important when we do an asana, because I have a lot of patients who are yoga teachers, and they end up with problems because they hyper move their joints. Mm-hmm. So the person who is hypermobile, like our gymnasts, they usually land up with bigger osteoarthritis in a later age. So all our gymnasts usually are pre-puberty or at a very young age. But by the time they cross 40 or 50, many of them get into osteoarthritis because they hyperextend or hyper move their joints. So yoga is not about flexibility, it's about alignment. So the person who is the most flexible is not the person who is doing the best asanas. The person who is doing it in correct alignment is doing the correct asana. Mm-hmm. And using the musculature in the correct way. Yesterday, I was teaching my physiotherapist, and my topic was yoga in pregnancy. And I was teaching them the asanas, and I was telling them in detail how to get into a posture. And they said, but ma'am, how do we remember all these instructions? Because the reason is the instructions are very specific. It's not about just doing Surya Namaskar, 50 Surya Namaskars. How are you doing it? Because I get too many people, because of the yoga boom, getting problems. And they say, we are doing yoga every day. How can I get a knee problem? How can I get a spine problem? But they do. Yeah. So hypermobility is not good.
Okay, so this is deviating a bit from dentistry, and probably the last question. What are the ill effects of flat foot and how do we cure it?
So it's so surprising and amazing. If any of you stand up just now in the audience and tighten your glute muscle, you will find that your arch of the foot gets lifted. If your glute muscles are strong, you will find that the arch of the foot gets lifted. So glute muscles control are like our remote controls. They control the arch of the foot. So most people who have flat foot have weak glutes. That is my experience.
Wow. Okay.
So if you tighten your glutes well, you will feel your arch getting. It's not big a movement. It's a small movement. You can perceive the movement if you concentrate on the arch of the foot. But if you can't, if you tighten your glutes and if they're very, very weak, then your arch will still remain not lifted, and you have to do glute exercises. So all people who come with flat feet, I always teach them glute exercise. There was a very funny incident recently. One of the persons, a young fellow playing regularly football, he came with a flat foot problem and pain in the plantar fasciitis problem. So I started teaching him on day one glute exercises. And he said, after about 10-15 minutes, he's telling me, ma'am, I think you've forgotten, I have a foot problem. I said, I know very well that you have a foot problem. And then I explained to him, why am I teaching him glute exercises?
Yeah. And I've seen this kind of change with you so many times. I had neck problem, and you diagnosed me with some of the muscles of the back. I had this knee problem, and you diagnosed me with the glute muscles. So it is interesting, friends, that it's not like we have a referred pain. Sometimes patient has got a deep cavity in upper wisdom tooth, and he complains of sensitivity in lower incisors. Okay, and we are, as a clinician, have to diagnose that there's nothing wrong with this front teeth. This is the upper last tooth which we need to treat. Exactly the same thing in physiotherapy science. We find this kind of surprises quite often. So it was interesting to know that contraction of the tightening of the glute muscles leads to lifting of the arch of the foot. It was really interesting to know, and a lot of insights which you have given to us, where I feel we are lucky. We have got a reset button to our life. Of course, our incomes are affected, but there are a lot of things which we can do. And one of the thing is giving time to our physical health, and we have got good time. We all must put our efforts into exercises, into correct way of exercising, whatever science you like, whether you like more into weight training or into yoga or whatever. But do contact your physiotherapist, correct your postural or whatever mistakes you have, errors which you have in your exercises, and please follow a better, healthy lifestyle. Ma'am, do you want to close this lecture? I think you are having poor internet connection. So I thank you, Bombay Dental, thank you, Sensodyne GSK, for this wonderful session once again. And these are some of the different sessions which we are taking in our COVID series, other than routine dentistry. Like we had a psychiatrist couple of weeks ago, and today we have a physiotherapist, Dr. Snigdha Mehta, who has really explained us well about the routine problems which we can have. Thank you, ma'am. Thank you so much. And I think we will call you for another session with another set of issues that we have.
Thank you. Thank you for inviting me. Thank you, Dr. Bajaj.
Thank you. Thank you.
It was my pleasure.
Take care, everyone. Please take care. Maintain social distance. And whenever you go out, mask, double mask. Thank you. Thank you so much.